Hi, everybody. And the format, as you probably know, is that I'll talk a few minutes about a topic and then we throw it open for whatever kind of questions or Q&A that you'd like to do. The topic tonight, I thought I'd done this, but I keep track of the topics and I look back and we hadn't. And it's one that I think is important, and that's procrastination. And I could make a lame joke about putting this off, but procrastination is really quite a serious thing when it comes to addiction. I just want to kind of talk about what it is, what it's not, and maybe how it interfaces with addiction and what we can do about it. But if you want to describe or define procrastination, I would say it's an automatic, negative problem habit of needlessly postponing things. And when I say automatic, that's a key word here, because this is an automatic process. It's a complex process that we'll talk about in a moment, both in how it's structured and how we can kind of overcome it a little bit. But there are basically three elements of procrastination in this complex procrastination. The first is an emotion, and it almost always includes an uncomfortable emotion. And that can range from just a little whisper of a fear to a full-blown panic attack. Usually they're negative emotions. And this is where addicts get in trouble too, because they start to feel uncomfortable and start to go to a drug or a behavior to soothe, to self-soothe. So that's the first part of it, of procrastination. The second is a behavior, some kind of diversionary activity. I have some favorites of my own. Sometimes if I have a big job to do or a big project, it's overwhelming that I want to check my inbox to make sure all my emails are cleaned up before I start. Or walk the dogs, or do something else to kind of defer. So I think that behavioral thing is these diversions that we take ourselves down some path on. And the final thing is a thought. So we have emotions, we have behavior, and we have a thought. And that's something, basically usually a little bit of distorted thinking, like, well, I'll just fix this problem later. And so that's how these all, that's the elements of procrastination. So if we look at it in addiction, how does it play a role in addiction? One is obviously putting off the inevitable, right? I think as addicts, speaking as an addict in recovery, I know that when I was trying to avoid the inevitable, as my world was kind of falling apart, I went through this whole process of anything but my drinking and drugging. So I thought, well, it must be because I smoke, and I'll quit smoking and that'll solve my problems, and it didn't. Or, gee, maybe it's my diet, I'll become a vegetarian, and that didn't do it. Or maybe I have too much time in the evening, so I got a master's degree at night and still managed to drink and drug all around the edges. And then I needed something to love and to love me, so I got a little kitty, and poor kitty in my crazy household. But anyway, so these are all diversionary tactics for me to kind of delay dealing with the real issues. And I think that's where, with procrastination, we kind of push the line along, or we'll draw a line in the sand. I've had so many chemsex or meth users I've worked with who will say, well, gee, I'll smoke it or snort it, but I'll never inject it. And soon they're injecting it. Well, I'll inject it, but I'll only do it, safely, or only do it once a month, or all these lines that inevitably get crossed with addiction. So that's how procrastination works. One thing I think people often mistake about procrastination is that it's an issue of time management, and it has nothing to do with time management. I think people think if they can just make their to-do lists in the appropriate length and budget their time properly, and things will get done. But really, that's just ignoring this complexity of procrastination with those three components: the emotions, the thoughts, and the behaviors. So, a couple of things to move this into recovery, to get past procrastination, to deal with it. One is that, let's take the emotions first. The task there is to really build tolerance for uncomfortable emotions. So to learn how to, and this is something we do with our clients at Seeking Integrity too, is to sort of, because we run a group where it's structured, it's contained, we can say, okay, let's just sit with that feeling. What is it? What's really going on? And I think addicts and partners too, I think, want to kind of not, as soon as they get uncomfortable, they go into their diversionary routines. So I think just really building a tolerance for it. And that has an absolutely concrete, practical application for recovery, because if I get a craving or a trigger to use or act out, I need to be able to sit through that. And we know from cravings that they'll peak like a wave and they'll pass and they'll reduce. But if I just feel I can't possibly resist this, I'm in trouble. So part of the skill is dealing with how to process the emotions and have a tolerance for being uncomfortable. instead of just avoiding the pain all the time. The second thing is to really look at your thoughts and what are our thoughts telling us. And if I'm having a trigger or a craving, my thought might be, oh my God, I can't stand this. I've got to use right now. You know, I'll quit tomorrow, which is the title of a classic 12-step book. Or you just can't stand the tension of not drinking or not using in this very moment, and everything else gets kind of deferred. So those thoughts kind of are not our friends in those moments. And then the final thing, we had emotions and thoughts, and that's the behaviors. And that's to really make a checklist of the kind of healthy behaviors that we can do. So am I taking problem-solving actions to contain or control my drinking or drugging behaviors? And what am I doing? It's not enough to manage the feeling. It's not enough to have good thoughts. It takes that third component. It takes all three, that third component of really taking action with it and repairing it. So what we do to help people move and deal with procrastination is really to start having them become aware of all three of these things on an ongoing basis. And Smart Recovery is one of the recovery strategies that's out there. One of the tools they use is as a weekly checklist of these three things. So you can kind of self-monitor. How have my thoughts been this week? You know, did I employ any diversionary tactics, or did I really kind of handle my thoughts and my feelings? So to really sort of self-monitor. But I think the key here, and then I'll shut up, is the fact that we need all three of these. It's not a matter of time management. It's not a matter of just simply willing yourself to do it, but to really understand that procrastination is a very complex phenomenon that is designed to help us avoid uncomfortable feelings, avoid consequences, and avoid feeling bad. And I think despite all the pain addicts go through, and their partners go through for sure, our primary, at least my primary goal was just avoid all that pain, no matter what. And so I think that really played a key in my own procrastination. So I think with that, I'll stop, and we can see where we go. Can't hear you, Scott.
Sorry, thank you, David. In the chat feature, somebody just said they missed the three things to do. Can you, or I'm not sure if it was the three elements or the three things to do. Can you just quickly review those?
Actually, they're related, because procrastination is really made up of three steps. One is having an uncomfortable emotion that people want to kind of avoid, and that can be really extreme pain or anxiety, a panic attack, or a worry, just something that I want to check out on. It requires a thought, corrective thoughts, so that sometimes we tell ourselves, I can't stand not to drink something right now, or I'll do this later, or it's not really that bad, or whatever those kind of minimizing rationales we tell ourselves. And then the final thing is behaviors. So to really have behaviors where we don't succumb to cravings and triggers, but really what can we do actively to kind of counteract them? So those three elements are the ones that I think are important in this.
Okay, thanks, David. For those of you who joined us late, our topic today is procrastination, but you can ask questions about absolutely anything related to addiction, recovery, whatever's going on in your life. We've got a good one in the Q&A. Use the Q&A feature, that's the easiest, and I want to get to that in a second. But before I do that, I wanted to add a couple quick things. David talked about getting into action. As a recovering sex addict, I have a circle plan, and my outer circle is a bunch of actions. And sometimes when I'm stuck on things I need to do, I can switch to one of the things that I like to do for a few minutes and then switch back to something I need to do. But I use the thing that I like to do to get me moving, because inertia is inertia, and it's easier to get out with something fun than it is to get out by cleaning the toilets, which I don't enjoy. So another thing that I have learned, I do keep lists of to-do lists, and I shorten them. I have a big long list, and actually what I do is I highlight in yellow the stuff that needs to happen today. And then I mark those things off when they happen, and I get rid of the yellow, and by the end of the day, there's no yellow on my list, and it looks great. and then I do it again the next day. If I look at the whole list, which is, you know, a page and a half long, I freak out, and I can't get anything done. And then the other thing I wanted to bring up, and I have two wonderful friends, and they are horrendous procrastinators, and they both do the same thing. It's paralysis by analysis. They plan and they plan and they plan and they plan, and nothing ever happens. David, do you see that with procrastination?
Oh yeah, that could have been me too.
Oh, okay.
Yeah.
So yeah, it's and I you know, I'll look at them and say, let me see your list of planning, and then I say, what are you going to do today? They have no idea, so I mark like 3 things. Let's say, do this today, and then call me tomorrow. So yeah, a couple things in the chat feature real quick. Let me check. Let's see. Are you saying that my extreme procrastination is related to my addiction? That's a horrible yet wonderful thought. I'll think about it later. Would you say procrastination and addiction are related?
I would say he could probably think about it now too. That's a great example of procrastination.
Yeah.
Absolutely. I mean, that's the thing we just really talked about. The two go hand in hand. What they have in common are both uncomfortable feelings and acting to avoid pain. Emotional pain, physical pain, relational pain, pain with our spouses, or with the consequences of things we've done. And that just kind of feeds that cycle. So yeah, procrastination is all about what those 3 things I just talked about, the uncomfortable feelings, the thoughts that tell us I can't deal with this, I got to do this now, I'll quit tomorrow, and the behavior change. So yeah, absolutely. The 2 are totally intertwined, for sure.
And the other correlation with the cycle of addiction. With addiction, we don't want to feel something, so we do something to not feel it, but what we do to not feel makes us feel even worse, so we spin right back into it, and procrastination is the same way. We don't want to feel, so we don't do something because we're afraid to do it, or it just seems too big, and then because we don't do it, we feel even worse, and you know, the tension builds and the cycle builds. So yeah, I get it. Okay, we have several questions already. Good deal. The first one, first we have a bit of history that will help with the question. I have recently discovered that my boyfriend of 2 years is a sex addict, rated as severe by his CSAT therapist and behavior history provided. His brother began performing oral sex on him as far back as he can remember, at the age of 8 years old. Around the age of 10 or 11, he began messing around with male friends, and again in his teens. According to him, his sex addiction began about 20 years ago, around the age of 20. Sex was 95% of the time with males or females, including oral sex, penetrative sex, meeting in parks, trails, etc., etc., etc. Craigslist, and then over a 7-year period with one man, many multiple encounters with that man, stating the sex with the man was the best sex ever. He only watches male on male porn. Is this all sexual acting out, or could he be gay and in denial? This question is asked by a female.
Yeah, it's a really good question, because we get this quite often, where issues of sexual orientation and acting out on those issues, the sexual drive and the attraction, is sometimes confused with sex addiction. Now, from the behaviors, there's clearly sex addiction there as well. But I think it's important to kind of differentiate what is one's sexual orientation, which is kind of more inherent, as opposed to this addictive behavior. And I think certainly he needs to get the acting out behavior in check. But I suspect that his recovery from sex addiction will not affect his attraction to other men. So that's going to really stay the same. And that's not something that's pathological. That's sexual orientation is what it is. The behavior, the sex, the hooking up, the encounters, and by the way, that history of abuse, which really kind of set him up, I think, for a lot of these addictive behaviors as an adult, or even as a young adult or teenager, that clearly is part of the sex addiction and needs to be addressed. But I think oftentimes the sexual orientation gets confused because that really will remain a separate issue and will probably be unchanged by a successful sex recovery. That's not pathological. That's or part of his attraction, the spectrum of his attraction. So I think it's really important to differentiate that. Some people will come to treatment because they are uncomfortable with who they're attracted to, as opposed to sexual behavior that's addictive. And sometimes they have both, as in this case. But I think it's important to expect that the sexual addictive behavior can be addressed with, but the orientation, I suspect, will not. And I would question any therapist who would go down that path in terms of trying to squelch that behavior, or at least explore it and see what's really going on there.
Yeah. There's a good book written for women in your position called Is My Husband Gay, Straight, or Bi? It's by a guy named Joe Court. And I put a link to it on Amazon in the chat feature there. One of the tests Joe uses when he's working with the guys is, the beach test. You go to the beach, who are you looking at? And the romance test, when you're 80 years old, who do you want to be sitting in the living room watching the evening news with? If it's men, you're gay. If it's women, you're straight. If it's either or, you're bi. Those are kind of simple tests that Joe uses. I don't think it's quite so simple in reality with a lot of people, particularly when sexual abuse, early life sexual abuse is involved. Our arousal templates, David and I were talking earlier, we did a Q&A about arousal templates, and one of the things that came up is we can add to our arousal templates, but once it's there, we really can't subtract from them. Those things are going to be there, and we just have to figure out how we're going to deal with these. And about sex addiction, Dr. Rob often says sex addiction is not defined by who or what it is that turns you on. Sex addiction has nothing to do with being gay or straight or bisexual. It has to do with out of control sexual behavior, which it sounds like we're dealing with here. But a sex addiction therapist can treat the sex addiction, but the elements of the arousal template, they're going to say that they're going to stay there one way or another. But I don't think David or I can sit here and say, oh, he's bi, or he's this, or he's that,
Right. And a complicating factor for that, by the way, is when someone is sexually abused like that at an age, there's a certain part of themselves that becomes objectified, where they see themselves simply, or their value to other people only in sexual terms. And so we start to see them acting out sexually because that's where they get validation. That's how they see themselves. That's what they feel they have to give. And so that kind of complicates all the behavior. But I maintain the orientation is probably going to be part of his whole spectrum over time.
Yeah, sexual abuse does a number, whether it's same sex or opposite sex, whether it's family member, whether it's not a family member. It does a number on us. And there's a large percentage of sex addicts were victims of sexual abuse. Next question here. I know that my perfectionism has a large role in my habitual procrastination. I'm very busy with work, which is a good thing. I know that my procrastination largely comes from a place of fear of disapproval and judgment for others, but it's real. How can I use the tools and lessons in the 12 steps to combat this? Great question.
Yeah, that's a really great question too. And you're right, this idea of perfectionism, which is a whole other topic we should talk about sometime, because that also is much more complex than it would appear. Just like procrastination, I think, has these 3 elements I've been talking about. So I think one thing I would look at that jumps out if we're thinking about sort of dissecting the procrastination that we just talked about was the uncomfortable thought, the uncomfortable emotions, and the behaviors, right? So you talk about fear of disapproval, judgment from others, those uncomfortable feelings that kind of drive you into this behavior of overachieving or making everything perfect, not making a mistake. and kind of that's a strategy to protect yourself from disapproval or disappointing others or whatever it may be. So I think that the two are absolutely related. So I think these checklists I talked about, kind of maintaining, monitoring a weekly status of your thoughts and behaviors and emotions as they relate to procrastination. But I think also just looking at the steps and working the steps in a really sincere way. And it's funny because I think a lot of step work involves procrastination. I certainly deferred or delayed the fourth step as long as I could because I didn't want to look at it. That was an uncomfortable feeling that my strategy was to like keep going. Based on your question, when I finally did it, I had to do it perfectly. So I actually wrote it out and I typed it, and it was like a term paper. I wanted to make sure my sponsor approved. So yeah, the two are related, but I would encourage you to monitor those thoughts, emotions, behaviors, and then really jump into the step work, because I think once we face some of those underlying issues, you know, the fear of disappointment or the need for approval and those deeper issues, which is really the perfectionism and the procrastination are symptoms of how you're managing. And there are better ways, easier ways to manage that. Sure feel a whole lot better than being under the rule of perfectionism all the time or constantly feeling behind. So I would just jump in and be mindful about your thoughts, behaviors, and feelings.
Yeah, in all likelihood, if perfectionism is a character defect, it's going to show up in your step 4. You're going to identify it, and then in 5, 6, and 7 in particular, you get to work on it. And in my experience, character defects never go away. We just learn to manage them. And perfectionism, by the way, is a good thing until it gets out of control and causes you a problem. It's like every character defect. They're good things. I'm stubborn as hell, and that's a good thing until it spirals and takes me down the wrong path and causes problems. So yeah, and I had another point to make, but it has escaped me.
I'll just jump in. I'm a big fan of Carl Jung, but he talks about shadows, right? And I think of these character defects as our shadows. They're strategies that we don't think about consciously, but they develop to kind of help us protect ourselves. But they often turn on us. They don't really do the job. They jump in inappropriately. And so the strategy, and I agree with Scott, is that not to banish them, but to kind of befriend them in a way and make use of it and control it and understand it, as opposed to just kind of trying to fight it. Yeah.
Yeah, and I agree. And the other point I wanted to make, in his first response to this, David mentioned fear of rejection. That's part of our perfectionism. It's also part of our addiction, is the point I wanted to make. Addicts, we're afraid of how other people will respond to us and how other people will treat us and shame us and reject us. So we turn to something that's not intimate, that we don't have to become vulnerable for, like porn or drugs or whatever, to assuage our emotional discomfort. And perfectionism, we turn to doing nothing. We turn to, inertia rather than risk rejection. Oh, I might do it wrong. So these are very related. Yeah. Does procrastination always have the 3 elements, or can procrastination become so ingrained in daily life that it's just automatic? Like the habit of numbing out with games on the internet or porn or alcohol or whatever, and then last minute you do what's needed. Oops, ran out of time.
Yeah, I think most procrastination is this kind of complex procrastination I'm talking about, where there are these 3 elements, and even in the examples you just cited, I mean, there's a need to kind of numb out with games. That's really actually a classic example of procrastination, because it's dealing with uncomfortable feelings. It's like it's numbing out, it's losing ourselves, it's kind of floating away, which is really what drugs do. And then games are a very potent way of doing the same thing, and can certainly be done in an addictive way. A lot of the guys I work with who started out as young men and teenagers on video games. So I think there is a connection. I'm not saying it's inevitable, but I think they learned that there are different strategies to numb, and that was one of them. So I think it definitely is related in terms of these three elements. I think they can be so smooth and ingrained and automatic that it seems, seamless and flawless. But I would encourage you to kind of take a step back and look at that and pull it apart and see if you can identify some of those elements in there, because I think they're in there. I think you'll find them.
Yeah, and I'll go back to addiction again. Addiction feels like an automatic response, but really it isn't. There are still some steps that get us from the feeling to using or picking up or whatever. And I would say with procrastination, exactly what David hit, there are still some steps between the feeling, and it's always a feeling, and actually procrastinating.
Yeah.
Next question. I am a straight man, but I'm addicted to gay porn. How can I recover from it? I feel really bad after having sex with strangers, especially men.
That's a complex issue. It's short, but it's a tough one. We do find that people who become addicted to porn, for reasons we've talked about on this webinar before, we start to need stimulation, and we start to explore, just through the nature of porn and the thousands of images people look at with porn, stuff pops up that we may never have seen before. And we think that's pretty hot sometimes. And I've seen that happen a lot with different kinds of fetishes or kinks or styles. And I guess it's possible it could also move into gay porn for a straight man, just because it's exotic and it's different. So the recovery piece, I think I would plug it into a general porn addiction recovery and see where you end up. I think it's important to get the porn under control. Scott had just mentioned arousal templates. Once we get into these intensity addictive behaviors like chemsex or porn or sex addiction, that arousal template gets really skewed and heightened to the point where only a few kind of taboo things will do it for us. And so our whole arousal template needs to get we need to reboot our brain, as they say, and let the arousal template kind of cool down and come back to normal. And it may be that some of the gay porn or the homoerotic feelings go away with the porn or become less intense. As we just mentioned, oftentimes those things stay in one's arousal template. And I would just encourage you to see where it goes. I think only you can decide, your sexual orientation. But, and you've said here how you identify. So I think I would just go down a path of healing the sex addiction and see what happens. I think again, I want to just make the point though that a sexual orientation is a whole different issue from sex addiction. So it may be that your sex addiction gets under control and that attraction to men remains or is minimized, but still there. I can't tell or predict how it's going to end up, but I would just be conscious of that. The other thing, and I don't know you, I don't know if this is the case or not, but I think sometimes I see men who, and this typically is middle-aged or older men, who are still really uncomfortable with coming out as gay or identifying who they are. And there's a lot of confusion about that. And so I think they use a lot of addictive behaviors to kind of numb those uncomfortable feelings. And so it's all totally related and integrated with the addictive process. But I think the starting point is to get that porn under control and kind of see what happens after that. And the feeling bad about it, just to take the devil's approach here, that may be shame from getting in touch with real feelings. In the case of another person, I'm thinking of that they felt bad when they acted out as men, although they identified as straight. But the feeling bad, once they came to understand it a little bit more, was really shame for kind of touching something that felt authentic to them inside, in terms of being with another man. So it's very complex. Every case is different. And I can't predict or I don't want to suggest anything to you except to really work on the addictive part of it and be open to the feelings that emerge and see what happens.
Yeah, I would add, you are not alone in identifying as straight, acting out with men, looking at gay porn, things like that. It happens a lot. Addictions escalate, especially porn addiction. People end up looking at bestiality or same-sex porn or, child porn or, rape porn or, things that would have disgusted them when they started looking at porn, and suddenly that's what they need, because addiction is a nasty thing. I mean, nobody starts out shooting heroin. People start out drinking a beer or smoking a joint, and then suddenly they're in an alley with a needle in their arm and they don't know how they got there. That's what addiction does. And sex and porn addiction work the same way as substance addiction. So there are a lot of people that find themselves, whether it's a straight man looking at gay porn or whatever it is, in places they never thought they were going to go. Sex clubs with 100 people, or it gets crazy, and there can be a lot of shame about that when it goes against your values, your belief system, what you know to be true about yourself, or what you believe to be true about yourself. It can be really, really difficult. So, and to get to the truth, I think David's right. You have to deal with the sex addiction first, or the porn addiction in this case. And then you start seeing underlying elements and the whys and the wheres, and who, what, when, where, how, why, starts to become clearer, but it takes a lot of work. So David, our next question is related to this. Since I wasn't a part of your discussion about arousal templates earlier, might you talk a bit more about them? So I'll tell you, earlier I asked David the question, what is an arousal template? How does it form? And what happens to it over time? And why is it important in recovery? Which is about 4 questions all rolled into one, but I'll ask you that again, David.
Okay. So arousal templates can be compared to like a map or a guide in our heads of what we find erotically appealing. And we know from interesting research that they start to be in place like at a very young age, 4, 5, 6 years old, before we're even sexual beings, at least mature sexual beings. And so these templates really contain descriptions, tall people, short people, heavy people, dark, blonde hair, blue eyes, whatever. And those are kind of the core of who we find appealing. The thing about arousal templates and the danger of porn and sex addiction, by the way, is that as we're exposed to other things, we can start to pull those into our sexual arousal templates. And the more we reinforce them through focused concentration, like you do in porn, or by acting out, the stronger they get. And we just mentioned how with sex, porn, and chem sex, the stimulation goes very high. Scott described really beautifully how somebody can start out as kind of this vanilla porn, if you will, and really escalate into other kinds of things just because that's the only thing that gets them aroused. The unfortunate thing about that in addiction is all those things go into the arousal template and they don't really go away, which means that for someone in recovery from chemsex or sex addiction or porn addiction, there's always the potential that they could kind of reignite those old fetishes or kinks or whatever. And I'm not saying even fetishes and kinks are bad, but if it's an addictive thing, they can, if it's something that's related to their addiction, that can be reignited. And so that's a trap. I'll give you a real concrete example of the men I work with who use methamphetamine and sex, and their sex arousal templates have gotten kind of way off base. What happens also with porn and sex addiction and chemsex is that when you get in recovery, that stimulation was so high that you can't, unless you're using drugs or acting out, oftentimes people kind of lose their sexual desire for a while. And it comes back, but it'd be delayed returning if people continue to use those kind of hot button fantasies. So I've had guys that are not using meth, they haven't used meth in 6 months or 9 months, but they also can't have an orgasm unless they go to one of those dark fantasies that they had when they're using meth. And that just keeps it alive, and it postpones and delays the brain's ability to redo it. So bottom line with arousal templates, all this stuff goes in. The task of recovery is to really let that stimulation level fall back down again and to kind of reignite sexual interest in things that aren't related to our addiction. And so clearly that would, and for a chemsex person, that would be anything related to drugs and sex. But some of the scenarios that people get into, some of the fetishes, some of the very specific behaviors or scenes or whatever that they find. So I think I always use the example of a path in the woods. Scott's probably bored hearing this. We just talked about it. But I think these arousal templates, I think of them as the more we go and connect with them, it's like walking a path in the woods. And we know from arousal templates that the end of that path will never go away. That path will always be there. But what we want to do is not keep walking down it and just kind of let it get overgrown and kind of forget about it and develop other things that give us pleasure. So the arousal templates are still a work in progress research-wise, but it's really a fascinating topic and one that I hope we learn more about in the coming years.
Yeah. We've got another related question here that kind of follows from that one, so I'm going to take it out of order. It says, we often seem to mention meth addiction and sex addiction almost synonymously. What is the connection besides general addiction? And before I turn that over to David, sex addiction is one thing, porn addiction is one thing, substance addiction is one thing, and chemsex addiction is one thing. And David happens to be the world's leading expert on chemsex addiction. And with that, I will turn it over to David.
Boy, this better be good. So as Scott just mentioned, there's substance abuse or substance addiction, there's behavioral addiction, sex addiction, porn, and those have traditionally been treated as two separate things. And sometimes the same person has both. But with chemsex, it's a very specific phenomenon that involves really a change in the brain, where the brain connects these two things, and it connects drug use and it's combined with sexual behavior. So the two become fused. There's a phrase in neurology that says what fires together, wires together. So that basically means if I keep doing the same things over and over again at the same time, the brain is going to say, well, let's keep this efficient. We'll just wire those two things together. And that's why I really have strongly believed in chemsex as kind of a third thing, because I've seen so many clients who had, I believe, chemsex with usually methamphetamine and or cocaine and sex and other drugs too, but usually there's a stimulant involved. They've gone to traditional substance abuse treatment, the belief being, gee, when they get clean and sober, all that sexual cravings kind of fall away. And it doesn't. In fact, the sexual craziness continues and triggers the addictive behavior again. And so there's this going back and forth. So really what's unique about the program at Seeking Integrity is that we approach chemsex as kind of a third thing and closely related to sex and porn addiction, almost closer than it is to other drug addictions because of the behaviors and the sexual behavior. So there's this sexual acting out component that really is driven by the stimulants, the amphetamines, but it also changes because of those high dopamine related drugs. They really use these behaviors so that, for example, if I have a chemsex client who gives up his drugs, as I mentioned, he'll lose his sex drive for a long time because the two go hand in. If he gets a sexual thought, he's going to have a drug craving come in right behind it. Or if he has a drug craving, he's going to get a sex craving. The two go hand in hand. And it creates a minefield for people in recovery because there's so many triggers that have to be kind of undone and managed. So that's a quick lesson. But yeah, the two, I view chemsex as a third thing. It's not sex addiction. It's not substance abuse per se. It's a combination of the two, not just by definition, but in how they affect the brain and changes in the brain.
Yeah, I totally agree with that. I am personally an alcoholic and a drug addict and a sex addict. If I have a sex thought, it does not trigger an alcohol thought or a drug thought. If I have an alcohol thought, it doesn't trigger a drug thought or a sex thought. If I have a drug thought, it doesn't trigger thoughts about alcohol or sex for me. I think I have I have one addiction that manifests in three separate ways, but there's not that fusion for me. But a lot of people, it really is one addiction. And it's perfectly possible to be just an alcoholic or just a drug addict or just, but what I find is, I go to a lot of AA meetings and people identify as an alcoholic, but what they are is garbage cans. You know, any substance that will get them out of their head, they'll go for it. And then when they get sober, they put on 30 pounds because ice cream is their fix, or they start acting out sexually because that becomes their fix.
Or they run up the credit cards.
Yeah, run up the credit cards, whatever. You know, addiction is getting out of our head. And when you take away our favorite toy, we're going to find another toy until we realize, oh crap, you know, I'm just playing whack-a-mole here with different addictions, which is what I did for a couple of years before I actually got some sobriety. But I had to deal with everything, you know, not just the obvious stuff. So, yeah. Do you want to add anything to that, David? Or?
No, I think that's good.
Okay. Is it normal for addicts to always struggle with overwhelming feelings of failure? A little background, I had a good job in South Korea, made a major international move about 13 months ago back to the United States. 13 months later, I still have no income. Haven't been able to get a business off the ground, haven't gotten an interview even for the jobs I've applied for. Started in recovery for a few months ago, but it's not going so well. I feel really vengeful and angry at anyone who is succeeding at anything, including recovery. I feel like I've even failed at failure. So is that normal?
Wow, I'm sorry that you're having such a hard time. I think those ideas of failure do go with the territory at first. I think there's a couple of things going on there. One, just from a psychological point of view, I think with addiction and these high levels of stimulation that they create, once we move into recovery or try to move into recovery, we experience what we call anhedonia, which is this inability to experience pleasure. So everything seems kind of gray and unpleasant and bad. And there's a kind of no joy, there's no spark. So that's part of the mood set that I think goes with that. But the feelings of failure, I think, are certainly not a place you want to be as you move into recovery. So I think there's a couple things I would suggest. One, if you have the help of a therapist or professional who can guide you, because I think there's sometimes, we've talked about that on this webinar too, negativity bias, which is simply this idea of starting to just see all the crap in our lives and really not having, not being kind of blind to anything good. Now, it may be that, and I've had times in my life when it was mostly crap in my life and not much to see. But I think it's a part of a way of seeing the world and approaching the world and trying to find some bit of goodness. My life was such a mess from my addiction when I got in recovery. Frankly, it took years to clean up. But I had some tool. I couldn't stand to exist in your spot or that shame spot or whatever negative emotion I was seeping in. So I used tools, and one that I'd recommend that helped me is the gratitude list. And we've talked about that a lot about here too. Just, what is it? My life is falling apart. Everything's bad. Everything's wrong. But can I find 5 things today that sort of worked? And it may be that, okay, I woke up, I'm breathing, I'm alive, or I have coffee, or I'm not sleeping on the street, or whatever it is. But I think it helps at least counteract some of the overwhelming weight of some of those negative things. And I think it's really important. We talked about core beliefs and ourselves, and I think it's really important not to start to believe that we are a failure. That I mentioned that, well, maybe not tonight, but this sense of shame being this sense of like, I am flawed, something just wrong with me. I'm hopeless. And that's, there's a little flavor of victimhood in there, but also I think it's a place that a lot of addicts exist. And it's not a good starting point, not a good jumping off point for recovery. And it feels totally unnatural. And I used to want to smack sponsors who would have this kind of one-ish when my life was, but that slogan of act as if helped. I was able to also compartmentalize when and this is, I guess, a little bit of denial maybe, but I can say, okay, I'm going to worry about after I go to a meeting. Good use of procrastination, but it's like compartmentalizing that, so it didn't bleed into every area of my life and kind of poison everything. So tricks like that I think a mental health professional might be able to help you with as you maneuver it. But I sure hope you find some relief soon. That's a lot of weight to be carrying. Scott?
I agree with David. That's a lot to be dealing with all at once, and I really feel for you. Gratitude lists, going to meetings, talking about it. You're doing the right thing now. And gratitude lists, you put in there, thankfully I have some savings. Well, that goes on the gratitude list. You had a good job, so clearly you have some skills. That goes on the gratitude list. You're in recovery. There's a lot of stuff to be grateful for. It's just sometimes it can be hard to find it. So next question. Oh, go ahead.
Sure. Just throw in one other thing that it's very common. I would say every addict is probably clinically depressed when they start to get sober. And sometimes that depression stays around for a while. And so you might also want to be evaluated for that. Maybe that's kind of putting a dark layer on your mood that you might find some relief for with therapy or antidepressants or something.
Okay, next question. I tried to stop, this is from the straight guy who's watching gay porn. I tried to stop watching porn and hooking up with strangers for a period of time. Yet when I am stressed, I come back to porn and hook up to get out of my bad feelings. I feel very guilty for not telling this to my girlfriend. And this drove me back into my sex addiction.
Right, so that really is that classic cycle, right, of trying to stop watching porn, hooking the behaviors that have crossed a line with ourselves that we don't feel good about ourselves for doing, but we can't seem to stop doing. That's such classic addiction. But when you're stressed, and this is also classic addiction, when we have an uncomfortable feeling, really the behavior, whether it's drug use or sexual acting out or porn, is self-medicating. We're taking, that's our medicine. And we do it to numb feelings, to escape from feelings, to break away. And that painful addictive cycle that you kind of describe here of where we feel bad, so we act out or we use drugs, which gives us a little window of escape momentarily. But then we come back, we feel shame about what we've done, and that whole cycle starts all over again. Feel bad. We need to self-medicate the shame and feeling bad for it. So you're caught in that loop to some extent. So what you're describing is all pretty normal for a sex addict or a porn addict. I think the only way to break out of that cycle is to really commit full-blown to your recovery and work on the issues and those boundary plans that we've talked about. You may find that there are some things that you need to do that can interrupt that cycle where when you're caught in it, where you can kind of short circuit that cycle so you don't automatically roll into acting out to numb or to escape an uncomfortable feeling, but you maybe can deal with the feeling in some other healthier way. So there are exit ramps from that cycle of addiction. And again, I think some professional help or somebody who understands this stuff, which would probably be a CSAT or somebody with a lot of addiction experience, because I found that people that just treat substances don't really get this whole side of it. So I think they could also provide some help. But I hope you can find some relief from that. That's a really painful place to be because we not only feel that we're affecting and impacting ourselves, we have no integrity for ourselves, but we're impacting other people. And that's what makes the pain just that much worse.
Yeah, and I don't want to run us off the rails, but keeping secrets from your partner is the quickest way to destroy your relationship. I'll just put that in there. So I'm glad you feel guilty about it. And I'm also glad you used the word guilty, which means you want to change your behavior, as opposed to ashamed, which means I'm so awful, I can't change my behavior. But to explore that would take another hour.
Yeah, and I don't want to get into too much disclosure here, but disclosure when we to our spouses and our partners about this is a pretty kind of formal process, and one that what an addict typically does is kind of this rolling disclosure where we sort of reveal something, we get caught in something, and okay, we own that, but all these other things we don't know, and this sort of torturous unrolling of behaviors that are just torture for spouses. I mean, it's just incredibly painful and traumatic. And so I think it's like another reason to have a CSAT or some kind of sex addiction therapist who can guide you in this and help you and your partner talk about this at the right time and in the right place and from the right approach.
Okay, thank you, David. Looks like we have one more question here. This will probably be our last one. It involves poppers. So David, real quick, can you let people know what poppers are before we get into the question?
Yes, so poppers are butyl and amyl nitrates. It was popular as a medicine, a cardiac medicine. Got its name like in the 60s from they would come in glass vials and people would pop off the top and inhale it, kind of like nitroglycerin, except it's a liquid and it gives off this really unpleasant smell. I think it's an unpleasant smell. But what it does, if you think about a cardiac patient, it just kind of blows open your arteries and all the smooth muscles relax, and it's kind of a head rush. And so a lot of gay men particularly will use poppers in conjunction with sex because it kind of heightens the orgasm. It sometimes makes anal sex more comfortable. There's this whole ritual that goes with poppers. So, and they're still sold. I think I've joked about this before. They're illegal, and so you can buy them in head shops and things, but they can't sell them as poppers, so they disguise them as other kinds of products. And most recently, video head cleaner. They've never upgraded their branding. So I've joked before, who has a video deck anyway? But that's what they're marketed as now.
Okay, so the question here is, my addiction was using poppers, no stimulants involved, and masturbation to numb out and escape. I've been in recovery for 9 months. I've had multiple slips. What should I be doing differently to minimize my cravings for this particular drug? I go to groups, have a sponsor, and I do step work. So I'm active in my recovery, but I still feel that I'm emotionally addicted to them, being that poppers are not physically addictive. You may want to address that last statement as well.
Right. So the whole idea of drugs being physically addictive or not, methamphetamine theoretically is not physically addictive. There's no withdrawal per se. If you try to admit someone for residential treatment, insurance companies won't pay for a meth detox because they say there is no such thing. But we know that meth is highly addictive from some point of view, and frankly, from a physical point of view as well. So pop are addictive. And they're addicted because we get addicted to the head rush. We get addicted to the sensation. And that's the anchor that really is the bedrock of that addictive process in our head. So I think I'd really approach it as a drug of addiction, for one thing. And you might want to even maybe go to some NA or maybe not AA because I don't think they'd really understand it or welcome it, but NA might, where you can actually isolate it and look at it as an addiction. But I would also really take a look at masturbation. Because we talked about the boundary plan before, and that inner circle are things that mean basically that we're in slip or relapse, and then the middle boundary are things that can kind of be questionable. And it may be that you want to take a break from masturbation for a while to break that habit, and put that in your inner circle, if you will, and deal with the feelings. Because remember, and this is kind of the theme of the whole evening tonight. Addiction is all about numbing. Procrastination is all about numbing. And I think what you're going to find if you stop masturbating and stop masturbating with poppers, especially, you're going to start having a lot of uncomfortable feelings come up, as every sex addict does when they give it up. And so I think getting the support in place, I'm glad you're going to meetings, but I think if you're just looking at masturbation as the problem, I think you really need to incorporate poppers into your worldview of addiction and deal with that, because although people minimize it, and I know a lot of people in recovery groups, that gay men who say they're abstinent from everything, but they continue to use poppers. It's like kind of, but to me, that's a real lack of integrity. And I think poppers are definitely mood-changing drugs, as you can attest. So I would approach it with a break from masturbation for a while, just because that seems to trigger. Actually, this is a perfect example. We were talking about chemsex, where the things bond. And it sounds to me like your masturbation behavior has fused with poppers. You like the sensation of that head rush while you're masturbating. That's like the textbook definition of something that's bonded or fused. And so to really approach that as one addiction with two separate kind of expressions, I think would be very helpful.
Yeah, when I work with guys as a sponsor-sponsee, invariably the topic of poppers comes up, and they want to know if they can still do poppers. And I always just ask the question, and this is in sex addiction recovery, my sponsees there, say, have you ever done poppers when the goal wasn't to be sexual? And the answer is always no. Maybe sometimes when somebody, if they're older, will say, oh, well, when I went to the disco in the 70s, everybody was doing poppers, while they were out on the dance floor. But these days, nobody's doing poppers unless they're planning to have sex. So my answer is no more poppers. Poppers are part of your addiction. David, you actually did some research about guys in AA who were using poppers, didn't you?
Yeah, because that phenomenon I just described so disturbed me that I kept seeing it, or clients would mention it, or I heard about it. I did an anonymous survey, and of it turned out to be about 200 men. I posted it on, it wasn't just local where I live, but on gay recovery groups on Facebook. And about 200 people, and a good percentage, more than half of those men were using poppers at some point while saying they were abstinent, which really kind of disturbed me. It's a little bit parallel to the nicotine thing, where at Seek Integrity, it's a non-smoking program because we think nicotine is a pretty nasty, addictive drug. And so poppers, I think, would fall in that same category.
Yeah, it goes back to the pathways in the brain. You just wire all this stuff together. And if you touch one part of an addictive pathway, it's going to trigger the whole thing. That whole pathway is just going to light up like a super highway. Right. And poppers will do that. Masturbation for a lot of sex addicts can do that. Some sex addicts, some recovering sex addicts can look at porn, and God bless them. I can't. It's been in my inner circle, it's been in my middle circle, and it always keeps getting moved back to my inner circle because it just doesn't work for me. It triggers a whole super highway of things, that places I don't need to get to. I think poppers are the same way, particularly for sex addicts. Yeah. Triggering a place you don't want to go. Yeah. So David, do you want to wrap us up with a little overview of procrastination to take us out?
Yeah. So first of all, I want to thank everybody for great tonight. This is really terrific. So procrastination, as we mentioned, 3 components just to be aware of. It's not a time management issue, but you really look at the emotions that you may be trying to escape from, the thoughts that you're telling yourself to kind of justify it, and the behaviors that you're doing. And just to really be mindful of all those 3 things. And oftentimes your procrastination is going to improve a whole lot if you have that awareness.
Thank you, David. Thank you, everybody, for joining us. David and I will be back next Wednesday, same time, same place. We hope you'll join us again, and we'll see you soon. Thank you.
Great. Thanks, everyone.